February is Heart Health Month, the time to learn more about heart disease and the signs and symptoms.
John Klimczak of West Hartford was blindsided. He was fine one day and in the hospital suffering from a heart attack the next. And this morning, he's here sharing his survival story with us. Thanks for joining us.
Oh, it's my pleasure.
So you were fine one day in the hospital. What happened that...
Well, October 12th started like any other day in my life. I woke up and I was getting the kids ready for school and getting ready for work, and I left my normal scheduled time, and I started driving to work. I work at One Beacon Professional Insurance in Farmington, and coming from West Hartford, I was going down Route 6, and I was having a weird sensation in my chest, and I thought it was indigestion, but then it gravitated to my left arm, and so I started shaking my left arm. And I really didn't know what was happening. And at the time, I was wondering if I should go back home, because I knew I wasn't going to work,
right.
At least to work the day. But I opted to go to work, and I got out of the car in the parking lot, and I was still having that aggravated sensation. And I was walking around the parking lot, and my coworkers, Gail Fossey, who was a receptionist at One Beacon Professional Insurance, and Jason Mitchell, who works there as well, they saw me and they pulled me aside. And Jason, interestingly enough, knew the symptoms, and he said, "John, just sit down and just relax. We're going to call 911." And I'm like, "You don't have to call 911. I'm fine. I'm fine." Well, thank goodness they did, and thank God they did, because the emergency staff came and they took care of me, and I was still conscious, and I was. They asked me where I should go, what hospital I wanted to go. Having never been in the hospital before, right. I was like, I don't know. I mean, I'm like, let's go to UConn, because it's less bumps. I remember saying that to myself, because it's in the Farmington Valley, and I knew my wife could get there quicker. Well, that was the best decision I could have ever made, because I went in the ambulance without sirens, but I finally got there, and they put me in my little emergency cube, and I was still having a sensation, and then within minutes of getting there, I went into full cardiac arrest. I started convulsing on the gurney, and instantaneously 11 people, I was told, just converged on me, and they gave me CPR, and they tried to defibrillate me 15 times. They shocked me 15 times.
At that point, did you have any idea what was going on? Were you conscious? Were you aware of what was happening?
I was conscious up to the point when my eyes rolled back in my head, and I just said, "Lord Jesus Christ, please be with me." And then for 40 hours after that, I was totally out of it. And my wife was there by that time. And by the grace of God, my life was preserved, and they defibrillated me 15 times to no avail. But the team at UConn Health Center was just so invaluable to me in my survival, because they got me going. They rushed me up and did an emergency angioplasty after they inserted a balloon pump in my femoral artery. And this is all, I learned about this after the fact, obviously, because it was just such an emergency. But I'm indebted to them because they never gave up. Dr. Michael Azrin and the cardiac team, the emergency team, the intensive care team was just invaluable.
Now, obviously, being that this is a blur, when you finally realized what had happened,
yes.
and that you came out okay, what went through your head? I mean, did you have a history of...
No, I had no history. I'm a 48-year-old with no prior history of any kind of heart problems. I try to eat well. My wife certainly tries to give me good food to eat, and I exercise, probably not as much as I should, but it was a wake-up call. And I'm blessed to be here, and I really am dedicated to sharing my story with other people. So, because it can happen to anybody at any time, and it's just so important to just understand what the symptoms are, and again, I'm just, I'm a part of the Mended Hearts organization now, which is a group that goes to heart patients in hospitals around the area and nationally. and they visit them, and they tell them that, you know, they're survivors. The visitors are survivors of heart situations, and we try to just share the medical miracles that occur and give them encouragement. I'm also active in the American Heart Association. I'm trying to get involved in that because, again, I am just blessed to be here. I'm sincerely blessed to be here, and I just feel that I need to give back. Actually, in December, I had the ability, my wife and family had the ability to give back to the UConn Health Center by sponsoring a luncheon for the cardiology unit, the emergency team, and the intensive care unit, who saved my life. And it was just something that we had to do.
Well, yeah, you're saying you're forever indebted to them because
Yes.
you were actually dead for about 30 minutes. You
Yes.
stopped breathing,
Yes.
and they just continued to work on you and
Yes.
bring you back.
And to this day, I don't know why they didn't stop, but by the grace of God, they didn't. I'm just so moved by their tenacity and their teamwork and their just abilities. It's a blessing.
Well, thank you for sharing your
you're very
story
welcome.
with us.
My
Thank
pleasure.
you very much.
Thanks,
My
John.
pleasure.